Welcome back to Open BXRx. Regional Aid for Interim Needs, or RAIN Inc., has been providing home healthcare resources and support for seniors and caregivers throughout the COVID-19 pandemic. Joining us now to share more is Dr. Anderson Torres, President and CEO of RAIN Inc. Dr. Torres, thank you so much for coming back on the show. We had you earlier on in the pandemic.
Oh, thank you, Ms. Lopez. Thank you for allowing me to represent RAIN at BronxNet. It's how should I say, it's a great experience to be back on the show as we have improved greatly with the COVID-19 experience in New York City.
And we want to learn about that. So can we just talk about RAIN Home Healthcare and your mission as well, just for those tuning in that may not be familiar?
Sure. So for many of you that are tuning in, RAIN is a not-for-profit organization that was established in 1964. To provide interim needs to those individuals that are in need. For example, back in the days, people that were discharged from Westchester Square Hospital and didn't have any resources, the founder at the time was providing those types of support services in the community, even if it was for a brief period of time, because it was felt that people needed that extra assistance at home as they were recuperating from their condition. And we've continued with that mission. The home healthcare program within the organization not only serves seniors, we also serve children. So it's from children to young adults, middle-aged to older adults. And the diagnosis from the children may consist of autism, developmental challenges. With the young adults, it could also continue to be cognitive challenges and individuals that are also recuperating from accidents and other brief conditions. So, we have different types of services for the different needs of the individuals that are trying to secure those services for home health aid.
And how has RAIN been ensuring that home health aides and clients are kept safe during COVID-19?
Wow, that's a great question, Ms. Lopez. You're taking me back to the height of the pandemic. We, like many healthcare institutions, had been challenged with securing PPE to make sure that our staff were protected and continue to be protected. We actually updated our website and we took a picture of people in their full PPE gear. But we were ensuring the protocols that were handed down by our governor's office and also our funding sources as well. So we had to restructure the way we provide services. Example, individuals that were reporting symptomatology, we were going also into self-quarantining, even with our own staff, making sure that, they were accessing testing as appropriate. We ordered gloves, we ordered masks, we ordered face shields, we ordered gowns, gloves, everything that you can imagine in terms of trying to keep an individual safe, not only for the home care worker, but also for the client at home. And so they were with very complex needs. We had situations like many in the industry had, where the patient or the client had concerns with someone coming into their home. And so some of them wanted to suspend services because they didn't want to be put at risk. They were saying, we don't know where the home health aide or the worker was, taking the bus, taking the train, being around people that, maybe with the illness. So there was a lot that we had to adjust to during this pandemic, but we were always able to provide a service. Unfortunately, we had clients that died as a result of COVID-19. Not only on the home care side, but also members from our senior centers as well. And we also had staff that died as well. So it was a mixture. There was a lot of loss, and there continues to be concerns with loss as well. We try to hang in there in terms of, giving people the support that they need, validating their concerns, their fears, also celebrating accomplishments and the perseverance of those individuals that still wanted to make an impact in the lives of those clients and for the clients that allowed us into their homes as well.
Wow. Thank you, Dr. Torres, for sharing that. My condolences to the RAIN Inc. Team for the losses of some of your employees as well as your clients as well during this pandemic. It has been a very tumultuous time, and it's very, very complicated to explore the depth of caregiving as well as those who receive the services who unfortunately have also passed from COVID-19. So I just wanted to explore some of the services that are provided by RAIN Home Healthcare and how people can get those services, as well as anyone who's tuning in who wants to inquire about a position or possibly be, working with RAIN as well.
Sure. Let me share a screen with you so that you could see a little bit or capture a little bit about, you know, what we're able to provide. But RAIN, as you see, we look at the social determinants of health, and then all these different types of services are really a part of the portfolio that the organization provides. Very popular, the senior centers, and our senior centers actually remain closed, but one of our senior centers just converted into a COVID-19 testing site.
Oh, wow. Which one is that one, Dr. Torres?
2424 Boston Road. And I can send you afterwards a press release to that. And it's all free, and it's within partnership with Health and Hospitals Corporation as well. You know, NYCHA's involved and other entities, but it's a whole public campaign from New York City to make sure that testing is provided to those members in the community. So that's the RAIN Boston Road Senior Center site is now a COVID testing site. We continue, you know, providing housing and reviewing applications for those individuals that are in need. There's a number here at the bottom left-hand corner, and that's part of the RAIN One-Stop Services. They continue to function and receive calls, and that's at 718-239-4358 to help connect people to services. We're also shifting our annual walk for the Alzheimer's Caregiver Link program. And so now, instead of all of us going to Orchard Beach at the same time, we're going to encourage people to do their walk virtually wherever they are at with close family and friends, and observing the social distance and wearing a mask accordingly to follow the protocols. And so that's a big change in terms of how we provide that service. When people come here for employment, and we do have several positions, not only home health aide, but others, and we're updating that on our website today, but they can call 718-892-5520, extension 171, and that is connecting to the Director of Human Resources, Ms. Lorraine Sullivan. Again, 718-892-5520. For those home health aides that are interested in employment with us, bilingual is especially helpful, not only in Spanish, but also in Russian, and also different African languages as well, like Edu, Fulani, and etc., because we have a very diverse patient base. And so that's very important to consider when you're applying. If you have a special skill that you would like to share with us, that would be greatly appreciated. You must have your certificate of completion for the home health aide course, having passed that course, your social security card, 2 references, and it's not that complicated. You will be engaged in a background check, as many agencies are engaged in that, and then we assign you to a case. We have cases that are split shift cases and so forth, 7-day cases. And so we assign different shifts to the different clients in their homes. You know, we continue to provide meals as well.
Dr. Torres, I'm sorry. Can we take off the share screen so we can see your face now?
Oh my goodness. Hold up.
To see your face.
I think the circle was much better, but you're right. But yeah, so again, you know, please visit our website, call that number that I provided with the extension so that you can get connected. I also want to emphasize that one of the challenges that we have had, an opportunity and a challenge, We've been able to increase our food distribution to homebound elderly. We actually went up to about 1,800 meals a day.
Wow.
In the Bronx. We also provided over at least well over 20,000 reassurance calls to our seniors. We're getting ready to have our next flow of interns from the schools of social work. We have Sacred Heart University, Fordham University, Silverman School of Social Work at Hunter College, Lehman College, just to name a few of the institutions that are going to be joining us soon with interns, and they're going to be helping in this endeavor. The challenge is that we have had so many people that have had deaths and it's been interrupted, and that has an emotional toll because then you're not able to grieve appropriately, and that might cause a certain trauma to individuals, where, my loved one has died, and I have a friend whose husband died in their home. He collapsed. They came, they picked him up, they took him to the morgue, and that was it. They couldn't have an appropriate funeral and invite others to come in. And then the wife was also infected with COVID. I'm thinking that it's time for us to do a Zoom, but focus on wellness and what you can do to really look at how we're dealing with our anxiety, with our fears, with our sadness. Think about how right now it may be very challenging, even for yourselves, when you see someone that you've known for years and now there's a mask and it's like, you can't really hug, you can't really kiss. We're a very touchy type of expressive community. And so those restrictions makes you think of, okay, let me go through my mental checklist of at least 5 things that I have to do differently in order to engage with another human being in the community.
Right. Thank you for sharing that, Dr. Torres. Definitely the uncertainty or the collective anxieties that we all feel from losing someone or possibly infecting someone during this time has kind of like put us, I don't know, like antisocial in an antisocial space. So I also wanted to share RAIN's socially distant hug initiative and what that is for seniors and caregivers and for anyone really. Is this campaign still open for those who would like to participate, and what is it?
Yes, let me tell you something. That, came up as a result of us really understanding how isolated these individuals are, individuals with disabilities, the older generation, as soon as our centers became closed and, being isolated. I said, how wonderful it would be to just get a little note, right? A little card that says, we're thinking of you. And we've also received drawings from children, and we've made those into postcards. And so they write the message, thinking of you, hope you're doing well, don't think you're alone, little inspirational and reassuring messages that goes out. So we would get those cards here. We would review them, make sure everything is appropriate, secure, and that there's good content that wouldn't jeopardize anybody that's receiving the card, such as advertisement, or not that we would think that anyone would write a nasty message, but we just have to take, safety measures. And then we would actually forward that over to the senior or the individual with a disability and mail it out to them. So we ask that the individual puts a self-addressed stamped envelope and with the postage paid, and then we will customize the address once it gets here so they can get to that senior. This is ongoing, so you can mail them to our main office at 811 Morris Park Avenue. Attention Card Hug Initiative program, and then we will take it from there. But people have called us to let us know how wonderful it was to just receive a note. And it was just because, without any, attachment to it in terms of marketing or anything like that. It was just because we care.
I love that. And it's a small gesture that means a lot to someone who's in isolation still throughout all these months. So thank you for spearheading that. And I hope that our viewers can participate in the socially distanced hug initiative by RAIN. Before we go,
And think about even the coloring books that you have, adult and for children, things that you color. You could rip out that page and you could send it to us, and then we can also forward that completed drawing to someone.
But before we go, just a message for the community to close out and how to stay connected, donate, and support Rain Inc. during these times.
Please visit our website, www.raininc.org, and there's a donate button on the top. We are also providing meals to hungry and homeless individuals, and monies that we get actually also help in that program so that we can continue that mission. We're doing about 500 people a day throughout the Bronx, and every little bit helps.
Thank you so much, Dr. Torres, for your time today.
No, you're welcome. I can't believe the time went like really fast.
Folks, you can visit raininc.org to find out more about their home health care programs, resources, and more. Open BXRx will be right back.